Hello and welcome to The Explainer. We all love a good sunny day, right? But sometimes that beautiful sun can leave behind a pretty painful red reminder. So today we're going to tackle a topic that is way too common: sunburn. We're going to break down what it is, exactly how to treat it, and crucially, when you absolutely have to see a doctor. And we're covering this today because this is a request we get all the time. It's a question that usually comes from a place of, ouch, I need help now. And it really deserves a clear, straight-up answer from a medical point of view.
So whether you're dealing with a nasty burn right now or you just want to be prepared for the future, this one's for you. Okay, let's dive into this.
First things first, before we can even talk about treatment, it's so important to understand what's actually happening to your skin. I mean, what is a sunburn really?
I want you to look closely at that term, radiation burn. Yeah, we tend to think of it as just getting a little too much sun, but that's the medical definition. It really highlights how serious this is. Your skin is literally being burned by UV radiation. And that redness, that pain you feel, that's your body's big inflammatory alarm bell going off in response to all that damage. And not all sunburns are created equal. Most of us, we're familiar with a first-degree burn. It's red, it hurts, but it's really only affecting that outer layer of skin, the epidermis. But if you start seeing blisters, well, you've just leveled up to a second-degree burn. And that means the damage has gone way deeper, which is a big sign you need to be much more careful with how you treat it. Okay, so the damage is done. You're home, you're looking in the mirror, you're red, and you're in pain. What do you do right now? These first few hours are absolutely critical for managing your symptoms, so let's get right into the essential first aid.
Just remember this simple trio: cool, hydrate, soothe. First, you gotta cool the skin down to draw out some of that heat. A cool shower, and I mean cool, not ice cold, or some cool compresses work wonders. Next, hydrate, but from the inside out. See, a sunburn actually pulls fluid to your skin's surface, which means it's taking it from the rest of your body. So you need to drink a ton of water. And finally, soothe that angry skin with a really gentle, fragrance-free moisturizer or some pure aloe vera gel. That'll help with the dryness and the discomfort.
All right, so you've handled the immediate crisis. Now you're entering the healing phase. For the next few days, your body is basically a construction zone, working overtime to repair itself. And, well, that comes with a whole new set of symptoms to manage. So here are the big do's and don'ts for the next few days. For the pain and swelling, an over-the-counter anti-inflammatory like ibuprofen can be a huge help. Then, as your skin starts to heal, it's probably going to get super itchy. The urge to scratch will be intense, but you gotta resist. Keep slathering on that moisturizer instead. And then comes the peeling. And listen, this is the single most important don't of the whole process. Let your skin peel on its own. I know, it's so tempting to, help it along, but that peeling layer is like a natural bandage. It's protecting the brand new, super sensitive skin underneath. If you pull it off too soon, you're just asking for potential scarring and a much higher risk of infection.
Okay, we need to get serious for a minute here. This is really important. While most sunburns, thankfully, can be treated safely at home, some are actual medical emergencies. They need a professional. You have to know how to recognize the red flags. So pay very close attention. If you see any of the signs we're about to talk about, it is time to stop playing doctor yourself and call a real one. First, just look at the burn itself. Do you have severe, widespread blistering that's covering a big part of your body? That's a major red flag. Next, pay attention to how your whole body feels. Things like a high fever or chills, feeling dizzy or confused, or a really severe headache. Those can be signs of sun poisoning or serious dehydration. And finally, watch out for signs of infection, like pus or the swelling getting worse, or if you start to feel nauseous. Any of those mean you need to get medical help and fast. We've spent all this time talking about treatment, but the honest-to-goodness truth is that the absolute best approach to sunburn is just to avoid it in the first place. Prevention really is the cure.
It sounds almost too simple, doesn't it? But this is the single most powerful piece of advice we can give. Every single sunburn you get adds to the DNA damage in your skin cells, and that damage just piles up over your lifetime. So let's make sure you've got the tools to stop it before it starts. So
Here it is, your prevention toolkit. Super simple. First, try to find some shade during peak sun hours. That's usually between 10 a.m. and 4 p.m. Second, make it a habit to cover up. Think wide-brimmed hats, sunglasses, and protective clothing. Third, always use a broad-spectrum sunscreen with an SPF of 30 or higher. And remember, sunscreen is not a one-and-done deal. You have got to reapply it every 2 hours and even more often if you've been swimming or sweating a lot.
And this brings us to our final and maybe most critical thought. You can treat the pain. You can soothe the redness. You can let the peeling happen. You can help your skin heal from the burn. But can you actually reverse the damage done at a cellular level? The answer is no. And that's a powerful reminder that taking just a few moments to protect your skin is always, always worth it. Thanks for joining us.